Welcome to Unspoken Minutes. Today, we're exploring some of the most astonishing and baffling medical cases ever documented. These rare instances challenge our understanding of medicine, the human body, and science itself. Brace yourself as we dive into these extraordinary stories in depth. 1. The Man Who Turned Blue. Paul Karason, Argyria. Paul Karason gained worldwide attention due to his unusual blue-colored skin, caused by a rare medical condition known as Argyria. Argyria results from excessive exposure or ingestion of silver, specifically colloidal silver in Paul's case. Silver accumulates in the skin, leading to a permanent and irreversible bluish-gray discoloration. Although not harmful beyond cosmetic effects, Argyria has significant psychological impacts. 2. The Girl Who Doesn't Age. Brooke Greenberg, Syndrome X. Brooke Greenberg's condition, known as Syndrome X, is incredibly rare and poorly understood. Despite aging chronologically, Brooke remained physically and cognitively similar to an infant throughout her life. Researchers believe her condition could hold clues to understanding human aging and genetic development, as her body developed unevenly and unpredictably, baffling medical experts worldwide. 3. Tree Man Syndrome. Dede Koswara, Epidermodysplasia Verruciformis. Epidermodysplasia verruciformis, commonly known as Tree Man Syndrome, is an extremely rare genetic disorder characterized by susceptibility to widespread human papillomavirus, HPV infections, leading to large wart-like growths resembling tree bark. Indonesian fisherman Dede Koswara became famous due to the severity of his condition. Although multiple surgeries temporarily relieved symptoms, no cure exists, making it challenging for sufferers to lead normal lives. The Woman Who Gave Birth to Rabbits. Mary Toft, historical medical hoax. In 1726, Mary Toft claimed to give birth to rabbits, creating a medical sensation. Doctors initially believed and supported her claims, which baffled medical and scientific communities. Eventually, it was exposed as a hoax, orchestrated by Mary to gain notoriety. Although fraudulent, this case highlights historical gaps in medical knowledge and emphasizes how easily medical professionals were deceived without modern diagnostic tools. 5. Cotard's syndrome, the walking corpse syndrome. Cotard's syndrome, or walking corpse syndrome, is a rare psychological condition where individuals believe they are dead, don't exist, or are missing internal organs. It can lead to extreme depression, self-neglect, and other dangerous behaviors. This delusion results from severe depression, psychosis, or neurological disorders. Treatment typically involves intensive psychiatric care, including medication and therapy. 6. Hyperthymesia. Jill Price, superior autobiographical memory. Jill Price was diagnosed with hyperthymesia, a neurological condition granting individuals an extraordinarily detailed autobiographical memory. People with hyperthymesia vividly remember almost every detail from their personal experiences, often described as a continuous stream of memories. Although impressive, this condition can cause overwhelming emotional stress due to the constant replaying of past events, making everyday life challenging. 7. The Human Werewolf. Hypertrichosis. Hypertrichosis, also known as werewolf syndrome, is an extremely rare genetic disorder characterized by excessive hair growth over the entire body or isolated areas. Historical figures like Fyodor Jeftichuk gained fame due to their unusual appearance. Although harmless physically, this condition can lead to severe social stigma and psychological issues, and no definitive treatment currently exists. 8. Foreign accent syndrome. Foreign accent syndrome is a rare neurological condition usually caused by traumatic brain injuries or strokes. Affected individuals begin speaking in an accent foreign to their own native tongue, without any prior knowledge of the accent. The condition is thought to result from changes in speech patterns and muscle control in the brain. Although rare, documented cases have intrigued and puzzled neuroscientists. 9. Progeria, Benjamin Button disease, Hutchinson-Gilford progeria syndrome. Progeria, or Hutchinson-Gilford progeria syndrome, is a rare genetic disorder causing accelerated aging in children. Individuals affected by progeria appear elderly, experience hair loss, wrinkles, and cardiovascular issues from a very young age. Although intellectually unaffected, life expectancy is significantly reduced, typically to around 13 to 20 years. Researchers study progeria extensively to gain insights into the aging process. Stoneman syndrome, Fibrodysplasia, Ossificans, Progressiva, FOP, Fibrodysplasia ossificans progressiva, FOP, known as Stone Man syndrome, is a rare and debilitating genetic disorder where muscle tissue and connective tissue gradually turn into bone, restricting movement severely. Even minor injuries can accelerate this bone formation, eventually immobilizing sufferers entirely. Currently, no effective treatment exists, making early diagnosis crucial to managing symptoms and minimizing injuries. Final thoughts. These shocking medical cases remind us of the complexities and mysteries of the human body. Which case did you find most astonishing? Let us know in the comments, and subscribe to Unspoken Minutes for more intriguing stories from the world of medicine and beyond.